University, Dr. Van Putten, good afternoon.
Good afternoon.
Dr. Van Putten, tell the folks what all you're doing with the microlight laser in the world of dentistry and cancer patients.
Well, our patients are, we deal exclusively with cancer patients, and we work along with the radiation oncologists. Most of our patients, all of our patients are head and neck cancer patients, and so they go through chemoradiation protocols, which causes significant mucositis in their mouth. Many patients, almost all of our patients, have soft palatal ulcerations, tongue ulcerations that can be very, very large. And we're talking several centimeters in size. This is after 6 weeks of radiation or chemoradiation. So what we do with the microlight is the radiation therapists, the radiologists now know whether to send the patients to us. So many times they'll send the patients to us before therapy is over, maybe 3 weeks in, 3 to 4 weeks in. In fact, we prefer to see the patients early before the mucositis gets out of control. And so we'll take these patients and start them on the laser therapy using the microlight, and we will usually treat them through the end of radiation, and then probably 4 to 6 weeks afterwards, depending on how bad they are, how bad the mucositis is. The microlight has been an invaluable tool. We use it almost our laser clinics are 2 days a week, Tuesdays and Thursdays, and so we use it every Tuesday and every Thursday for our patients.
Well, Dr. Van Putten, I think it was an interesting story how you ended up using the 830 wavelength. Can you take a minute and tell us that story?
Well, I've used lasers. I was using other lasers prior to purchasing the 830. I had some 2780 laser, the water laser, and also had a 940. But in reading the literature, I went through quite a bit of literature. In reading the literature, I saw that the absorption curve for the 830 was considerably different than the 940 or even 2780. In fact, I still use the 2780, but I know that I'm not getting great penetration, and that's the beauty of it. It's more of a surface debridement, cleaning up the surface, but I want biostimulation, I want healing. And so in order for us to get that, we needed better penetration. You wanted a deep penetration, and looking at the absorption curves, I came to realize that the 940 is better than the 2780, but the 830 is actually better than both, because you can get the 5 centimeters or so of penetration, which our patients need. Many of our patients come in with oral pharyngeal mucositis. Some of them have nasal pharyngeal cancer, and so the nasopharynx is being treated. But invariably, even though we're not treating cancer. Our purpose is not to treat cancer.
Side effects.
It's just the side effects. If they're treating the base of the tongue, the soft palate will be ulcerated. Also, if they're treating the base of the tongue, the oropharynx, the oral tongue will be ulcerated. And anytime a patient has a crown in their mouth, or any metal, the areas around the metal are going to be ulcerated. So we treat those areas with the low laser therapy to stimulate healing, to improve blood flow, to reduce pain. Wow. All of those things, all of the above, depending on the situation. But ultimately our goal is to get them to heal a lot quicker, so that they can get back to eating and get back to a more normal lifestyle.
Well, Dr. Van Putten, as we wrap up here, anything you'd like to share with fellow dentists that may be looking at the 830 for their practice?
Well, for healing, it's hard to beat it. And what I like about it is the penetration. If you have any kind of swelling after like third molar extractions, if you have a swelling in the third molar region, if you have any kind of tongue swelling, even periodontal problems, where you've done surgery, you want to accelerate healing, the 830 is a great laser to use. It's easy to use.
Your staff can use it.
Staff can use it. It's just very no risk, which is very significant these days in the medical arena.
And I think your patients like it too, don't they?
And the patients almost invariably, they always say that that they do feel better. But I take pictures of everything I do every week. and I put it in our medical records.
Database.
So every week when I treat my patients, I put a picture in the medical record, and it's been, and a picture is worth 1,000 words.
Proof pops.
It's incredible to see the healing.
Yeah.
You know, I've had patients who haven't had laser therapy who have gone 3 months. I used to get patients in 3 months post radiation therapy, still with large ulcers in their mouth, and that's just cruel and brutal.
Yeah.
To have an ulcer in a large 2-centimeter ulcer in your mouth for 3 months, but being able to get those patients healed in 3 weeks, 4 weeks. I have sometimes, like I had a patient today who I've only treated them 1 week, and they're still in radiation, and the ulcers are like half the size.
Wow.
So being able to get them healed quicker so that they can get out of pain and get back to a normal lifestyle has been huge. It's now, like I said, our radiologists, is standard therapy. They just send them up to, I can't keep up with the demand.
I think you're overloaded a little bit, aren't you, doctor?
I am overloaded right now. If you want to come work at the cancer hospital,
Right. Well, and I think as we talk today, maybe that hands-free model might start.
It will, yeah, absolutely. Yeah, and of course, using the paddles, that's what I like about this particular unit, because you can use the trigger point and the paddle at the same time.
Yeah.
That has really opened up our timing, because before, when we had the other microlight, the older unit, we'd have to do one area and then jump to a different area. But now I can do the mouth and we can do the neck all at the same time. So that really does it's a great time saver.
Well, it helps you and your staff and the patient as well.
Yeah, absolutely.
Everybody wins. Well, Dr. Van Putten, thank you so much for taking time to visit with us today.
My pleasure.
Thank you.